Progressive supranuclear palsy (PSP) is a rare neurodegenerative disorder that primarily affects movement, balance, and eye movements. It is part of a group of disorders known as atypical Parkinsonian syndromes, which have symptoms similar to Parkinson's disease but often have distinct features and progression. Overview. Prevalence. PSP is relatively rare, affecting approximately 5 to 7 people per 100,000 annually. It typically occurs in individuals over the age of 60. Cause. The exact cause of PSP is not well understood, but it involves the progressive degeneration of specific brain regions, particularly the basal ganglia, brain stem, and frontal lobes. Abnormal deposits of tau protein in the brain are a hallmark of the disease. Symptoms of PSP can vary widely among individuals, but they generally fall into several categories. Movement difficulties. Bradykinesia, slowness of movement, similar to Parkinson's disease. Rigidity, stiffness in the muscles, which can affect posture and movement. Postural instability, difficulty maintaining balance, leading to frequent falls. Eye movement changes. Supranuclear gaze palsy, difficulty moving the eyes, particularly looking down or up. This is a characteristic feature of PSP. Inability to blink, reduced ability to blink or control eye movements. Cognitive and behavioral changes. Cognitive decline, problems with memory, attention, and executive function. Personality changes, changes in mood, behavior, or personality, including apathy, depression, or irritability. Speech and swallowing difficulties. Dysarthria, slurred or slow speech due to muscle control issues. Dysphagia, difficulty swallowing, which can lead to aspiration pneumonia and other complications. Other symptoms. Sleep disturbances, including insomnia or excessive daytime sleepiness. Facial changes, reduced facial expressions, leading to a mask-like appearance. Diagnosis. Diagnosing PSP can be challenging due to its similarities with other neurodegenerative diseases, particularly Parkinson's disease. The diagnostic process typically involves clinical evaluation, a thorough neurological examination to assess symptoms and their progression. Medical history, taking a comprehensive history to understand the onset and progression of symptoms. Neuroimaging, MRI scans can help visualize changes in the brain, although there is no specific test for PSP. MRI may show atrophy in specific brain regions, such as the midbrain. Exclusion of other conditions, ruling out other disorders that may present with similar symptoms, such as Parkinson's disease, Alzheimer's disease, or multiple system atrophy. Treatment. There is currently no cure for PSP, and treatment focuses on managing symptoms and improving quality of life. Medications. Dopaminergic medications. Some patients may respond to medications used in Parkinson's disease, although the response is often less favorable in PSP. Antidepressants may be prescribed to manage depression or anxiety. Physical therapy. Tailored exercises can help improve strength, balance, and mobility. Physical therapists can also provide strategies to prevent falls. Occupational therapy. Occupational therapists can help with daily activities and recommend adaptive devices to improve independence. Speech therapy. Speech-language pathologists can assist with communication difficulties and swallowing issues, providing strategies to manage dysarthria and dysphagia. Nutritional support. Dietary modifications may be necessary for individuals with swallowing difficulties. Ensuring adequate nutrition and hydration is crucial. Support services. Counseling and support groups for patients and caregivers can help address emotional and psychological challenges associated with the disease. Prognosis. The progression of PSP varies among individuals. On average, people with PSP live about 5 to 10 years after the onset of symptoms. The disease generally progresses more rapidly than Parkinson's disease, with significant functional decline over time. Conclusion: progressive supranuclear palsy is a complex neurodegenerative disorder that presents unique challenges for affected individuals and their families. Awareness of the symptoms and early diagnosis can help in managing the condition effectively. Ongoing research aims to improve understanding and treatment options for PSP, but currently, supportive care remains central to enhancing the quality of life for those impacted by this disorder. If you're someone who knows experiencing symptoms associated with PSP, it is essential to seek consultation with a healthcare professional for proper evaluation and management.